Good morning. My name is Katie Pollock. The shift toward value-based practice has left healthcare exploring new models of care with a focus on maintaining high quality in a cost-controlled manner. This has identified a crucial need to enhance advanced practice provider utilization. In response, our institution established one-year pediatric subspecialty APP fellowship training programs. At the core of each subspecialties program is a general pediatrics boot camp curriculum, which aims for our APPs to gain exposure to common pediatric diagnoses and patient populations, to gain exposure to hospital-wide infrastructure, to recognize and triage commonly encountered pediatric emergencies, and to build a multidisciplinary community. A 4-week didactic curriculum was developed to include both acute care and ambulatory general pediatric didactic education, PAL certification, simulation training, and clinical observerships. Participants were full-time APPs hired into the Department of Pediatrics. We evaluated a curriculum with a pre-boot camp needs assessment, which was later compared to a similar post-boot camp survey. In addition, a pre-test was given during boot camp orientation, followed by weekly quizzes on the didactic material to assess the curriculum's impact on general pediatric knowledge gains. We uncovered several salient results over our near 2-year experience. To start, the majority of APPs enrolled in boot camp have less than 1 year of prior post-training clinical experiences. And of those that had prior experience, at least 23% had adult-only clinical experiences. We feel this confirms a continued need for these pediatric subspecialty fellowship programs. Integral to this bootcamp program is the desire to lay groundwork for meaningful connections across subspecialties and clinical roles. After completion of bootcamp, advanced practice providers felt more connected and very connected to other APPs and non-APP providers in the CHP community. We anticipate that this connectivity would sustain and even continue to blossom throughout their fellowship training. Regarding knowledge acquisition, after implementing a knowledge pretest on the first day of boot camp, we have found that the APPs have an average of a 24% increase from their pretest score to their cumulative post-test scores. Finally, the APPs demonstrated significant increase in their comfort level in identifying and initiating independent management of 3 common pediatric emergencies: acute seizure, respiratory failure, and septic shock. We have identified some limitations in our evaluation of this innovative curriculum. To date, we have a small number of enrolled APP participants, and thus early data is not powered for statistical significance. With regards to the knowledge assessment, our questions were written by the course directors and thus not validated. Finally, we do not know how the COVID pandemic will impact future curriculum delivery and evaluation. Thank you for your time. Please email any of us with questions.